Dr. Wolfe again, just popping in for another little update on that Matthew Perry video I made. First of all, if you watch that video, when I talk about the article and I say, delete this from your mind when it mentions drowning, what I'm saying is that early in the investigation, you cannot determine drowning unless it was witnessed. So it may well be signed out as a drowning case in the end, but that early, I think it was a little inappropriate for the article to state that. And as you may have seen, the medical examiner indicates additional investigation is required. So on Sunday, the cause of death was listed as deferred. Now let me explain a little bit about what that means. There are really three situations where we use that term. Number one is that you do an autopsy and head to toe, you don't find any signs of trauma or any signs of natural disease that could be immediately attributed to the death. Some people will phrase this no anatomical cause of death. The second reason is that there may be a piece of information needed to help you, and in this case, it's going to be toxicology. Toxicology may well be very important in this case. Even if an obvious cause of death is seen, you still don't want to sign that case out and give it a cause of death before you see if there are any substances in the blood that could have contributed. In addition, there may well be information like medical records that they want to look at. Or if you watch Dr. Judy Melanick's video on this same case, she talks about having the hot tub or the jacuzzi inspected to make sure that the temperature was appropriate and that there were no possibilities of electrocution, because that can happen. So that's not something that's going to be done within a couple of hours. I mean, that's going to take time for somebody to go out there and do all the testing. The third reason is that you find multiple explanations for why the person could have died, and therefore you can't settle on one without more information. So, for instance, you might find somebody with, chronic kidney disease and blockages within the coronary arteries. There is, I suppose, a fourth explanation for that, and that is some medical examiners simply do not want to release any preliminary information. I once worked with a medical examiner, and she would defer on every case, regardless of how obvious the cause of death was. She just didn't want to sign them out until she had everything, and I think that can be appropriate. In what is considered a high-profile case with many outstanding variables, I think it's entirely appropriate.